Good afternoon, everyone. Your microphone will be muted throughout the event. You can use the chat function to ask a question during the event, and the speaker will answer at the end of the talk. Please note, this event will be recorded. Please join me in welcoming Dr. Andre Das, consultant surgeon at Hospital Kajang, who will now share with us the training pathway on surgery. Over to you, Dr. Andre.
Thank you very much. Okay. Just give me a minute and I'll try to share my screen. Now I'm having some problems. Okay. Can you see the screen?
Yes, doctor, we can see the
Okay.
screen.
Okay. So, good afternoon, everybody. And thank you very much for inviting me to give this talk on a topic that I'm quite passionate about. And I hope at the end of this presentation, all of y'all should have an understanding of how surgical training is done in Malaysia and ways to get started if you all are interested in it. The outline of my presentation, first I will give you a general overview of the different pathways and what are the requirements to enter the programs. And lastly, I would like to share some personal thoughts and tips. In other words, what they don't teach you in medical school. And when I was the head of department in Kajang, I'm proud to say that I have been consistently producing about 2 or 3 candidates who have successfully entered the training program for the Masters of Surgery. And in fact, people have told me that the ratio of production of trainees for me in Kajang, based on the number of medical officers that I have, actually is one of the highest in the country, because we used to have something like 6 to 8 medical officers, and out of those 6 to 8, we used to produce about 2 or 3 consistently every year who managed to enter the program. Okay, for the start, I'd like to disclose that I have no vested interest in any of this presentation, and whatever advice I give you is without prejudice, and you have to take it within their context, especially the context of having a surgical career in mind. And I'm not sure whether you extrapolate to other disciplines like medical or not. I'm also a council member of the College of Surgeons of Malaysia, of Academy of Medicine, and I'm a trainer for ATLS and NOTS. ATLS is Advanced Trauma Life Support, and NOTS is Non-Operative Technical Surgical Skills, which are courses run under the auspices of the College of Surgeons. I'll be mentioning about 2 other courses: CCRIS, Care of Critically Ill Surgical Patients, and SOTM is Science of Tissue Management. And you will understand what is the relevance of these courses as we go along, and what's the importance of the College of Surgeons. Okay, some background information about the surgical field in Malaysia. Generally, if we base it on the National Specialist Register, we divide the surgical field into either general surgery and its subspecialty, or surgical specialty. And general surgery and its subspecialty means that you need to become a general surgeon before you can become one of the subspecialists of the subspecialty that is in general surgery. And I'll show you what they are. Surgical specialty means you can go directly and become a surgical specialist without becoming a general surgeon. So general surgery and its subspecialty will include disciplines, subspecialties such as hepatopancreatobiliary surgery, HPB, colorectal, breast endocrine, trauma, thoracic, upper GI, vascular, etc. Meaning that if you are interested in becoming a subspecialist in any of these, you have to become a general surgeon first. And the second division, what we know as surgical specialty, would be the specialty of pediatric surgery, plastic and reconstructive surgery, neurosurgery, cardiothoracic surgery, and urology. Meaning that all these specialists will stand alone. Gina, I call you back. All these specialties are standalone, and they you do not have to become a general surgeon to join and become such a specialist like a plastic surgeon. And what is the role of the College of Surgeons of Malaysia? Well, one of the reasons why I joined and I'm active in the College of Surgeons is because it has an aim to improve the quality of the surgical discipline, as well as to improve the quality of training in surgery. But more importantly is it aims to level the playing field so that everybody has an equal chance to enter the field and also to participate. It is represented in a lot of bodies in the MMC, Joint Technical Committee, Surgical Subspecialty Committee, which determines how candidates are allowed to enter and train for it. And it is a very inclusive society, meaning that it is open for people to write in, and if you have any questions, it will gladly engage with you. Although it is limited to surgeons, masters can join as associate members. And students, if you all have any questions, you can always write into the college to find out about details or whatever. And things that the college have looked into recently includes complaints about bullying, sexual discrimination, and there was a query about a certain element of sexual discrimination during the interview process for entering the surgical training. So the college also looks into all this. It has been very active in preparing for what is called the National Surgical Curriculum, which is in the process of being prepared. And also, the College of Surgeons initiated what is called the Conjoint Board of Surgery, which has united all the universities that are running the programs. And by doing so, it standardized exams, quality, and make the exams to become a surgeon as fair and robust as possible. It has also initiated a formal basic surgical training, and I'll talk a little bit of it later. And it has initiated ATLS, CCRIS, and NOTS training in Malaysia. And I'll try to talk about it also later on. So I'll give you all some updates of what's happening in the surgical field. There is a preparation being done for National Surgical Curriculum, and it is in the final stages for both general surgery and its subspecialty and the specialty, and it should be released soon. And this will influence training as well as entry criteria for surgery. Essentially, curriculum is a three-dimensional program and also a living object, means it changes from time to time. It takes into consideration needs of the learner, learning experience, and also the content in terms of specific performance, example, skills, knowledge, and syllabus. It is different from syllabus because syllabus is essentially what you need to know to study a subject, but a curriculum looks into all the overall aspects of learning and training. It is also instructional methodology, when and how to teach. Usually, trainers and lecturers will have direct access to the curriculums, and students will have access to the syllabus. Basic surgical training is an effort being conducted by the college also to start a program whereby a structured training for junior doctors or wannabe surgeons who have just started in their medical officer career. And if you look at overseas, this is already a fixed program that is being used as a requirement to enter surgical training. However, in Malaysia, it is still being trialed upon, and eventually I foresee that this will become a requirement for future medical officers who want to join the master's program, that they have to have a certificate that they have already undergone basic surgical training, and it uses certified trainers. An example of the basic surgical training structure is you develop a workplace portfolio, and you are required to do things like DOPS, where you do procedures and you observe to make sure that you're competent. and also clinical evaluation exercise where you observe how you clerk patients, how you examine to make sure that your techniques are correct and your approach are correct. And you have a lot of case-based discussion, particularly on focus on surgical diseases, and also a procedure-based assessment. And hopefully, once you have completed a BST, you'll be competent enough to carry certain surgical procedures such as appendectomy. So this has already been started on a trial basis, but eventually I foresee in the next 1 or 2 years' time, this will become a standard and also possibly a requirement before you can enter the surgical program. Okay, now we go into the meat of the talk today, the pathways into surgical trainings. So essentially, there are two pathways for most of the thing. Last time, you need to do a first degree in general surgery before you are allowed to specialize. But however, with the evolution, now we have got what we call surgical specialty. And for those surgical specialty, you can have a direct entry program, meaning you can go straight into the universities or organizations that are conducting such a specialty, for example, peds surgery, neurosurgery, plastic, without becoming a general surgeon first, or you can take an alternative pathway. Now, alternative pathway or parallel pathway is not a standardized term, and other places or different organizations may refer to it differently. But however, when surgery is concerned, we refer to alternative pathways are pathways to become a specialist on programs that have got an affiliation with external colleges, and in particular, the Glasgow and Edinburgh College. And programs that have alternative pathways are cardiothoracic, urology, and plastic, whereby there is a conjoined organization with the College of Surgeons of Glasgow and Edinburgh. And the alternative pathways are usually run in collaboration with KKM, universities, associations, societies, and colleges. Requirements for direct entry into specialization, that means you enter straight away into the neurosurgery program. It is currently run by and USM as a Masters of Neurosurgery. You need 6 months general surgical experience and 1 year neurosurgical experience. There's an exam and there's an interview. Pediatric surgery also conjoined between University Malaysia and University Kebangsaan with a Masters in Pediatric Surgery. There's an entry exam and there is an interview also. Whereas plastic and reconstructive is run by USM. You need an 18 months experience, of which general surgery needs a minimum of 6 months experience, and also other surgical related postings. There is an entry exam and there's an interview. Cardiothoracic surgery is offered as a direct program by UITM and IGN for a doctorate in cardiothoracic surgery. And to enter this program, you need either a master's in surgery, meaning you must be a surgeon first, or you have to undertake what they call it master's in cardiothoracic surgery, a 2-year program run by UITM before you're allowed to enter the doctorate in cardiothoracic surgery. And you need to be below 40 years of age at your registration. And the prerequisite for parallel pathway, whereby you will be conferred a degree that is also associated with a foreign college like the College of Surgeons of Edinburgh, you must pass your MRCS Part A and B, and you must have certain experience. In cardiothoracic, it's a 2 years surgical experience where you must be more than 6 months in general surgery and more than 6 months in cardiothoracic surgery. Urology and plastic, 2 years surgical experience, more than 12 months general surgery, and more than 6 months in their respective discipline. You must pass the interview by the board. And if you are from KKM, you must be registered as a trainee with the Perkembangan and fill up a certain forms. I'll show the form at the end of this, and you can probably get a copy of the presentation and you know where to, what sort of forms you need to fill in. For plastic surgery, you need a referee report. There's a structured CV, basic surgical training, and emergency and trauma management to enter the parallel program. And these are the forms, the BPR forms that you need to fill in. And also this is the checklist that you need to fill in to enter the parallel program as a KKM candidate. And general surgery, I'll spend a little bit more time in general surgery because this is the main bulk of the trainees. And in general surgery, currently, if you want to become a general surgeon, there is only one pathway, meaning that you have to get the Masters in Surgery, which is awarded either by these 5 bodies: University Malaya, University Kebangsaan Malaysia, University Science Malaysia, International Islamic University Malaysia, or KPJ. KPJ is a private organization. However, in the future, there are possibilities that other universities may also be conferred the right to grant such a Masters in Surgery. UPM has put in a request to be included inside, but it's still in the process of being evaluated. All these will be governed by the conjoint board, which I have mentioned earlier, together with the College of Surgeons, which also handles the entry and examinations. And I'll give you a look at what is being asked at the entrance evaluation for general surgery. The entrance exam is a specific exam with 60 MCQs, true false, and the syllabus includes principles of surgery, applied basic science, pathology, medical microbiology, anatomy, and physiology, and it carries a weightage of 40% towards the entry for the Masters of Surgery. That's the first. The second is an optional exam, of which there are 2 main exams, either the MRCS. So if you pass the MRCS A and B, you get the maximum 10 marks towards your entry requirement. The MEDEX is the latest examination that is conducted by the Medical Examination Board of Malaysia, whereby it has got exam bands and you will be getting marks based on the bands. If you get more than 90%, you get the full marks of 4 for the exam conducted by the MEDEX. And the other marks are as seen in the slides. If you have done any publication or research, you will also be given some marks, but the maximum marks you can get will be 10. That means if you have 2 international journal publication, you'll get the full marks of 10. Otherwise, international oral presentations, you will get 4 marks. National journal or oral presentation, 3 marks. Posters, abstracts, oral presentation at hospital level is 2 marks. If you enter any of these surgical related courses, you can get a maximum of 10 marks. And that is where the courses that I mentioned earlier, ATLS, CCRIS, DSTC, Science of Tissue Management or TOTS, you can get 3 marks each. Other relevant courses, but they have to be approved, will be of 2 marks. And relevant surgical conference, you can get 1 mark with a maximum of 5 marks for conferences. That means you can only get you can only attend 5 surgical conference to get the maximum of 5 marks. Beyond that, if you enter 6, you will not get any more extra marks contributing to your entry requirement. And if you do not know this, internationally, most surgical bodies have got the similar requirement. That means you need to have your ATLS or your CCRIS or your DSTC or NOTS before you're allowed to enter the training. So this is not just limited to Malaysia, such courses. Then you are required to have certain work experience, of which you need to be at least more than 2 years in general surgery to get the maximum of 10 marks. If you are in other surgical specialty, like for example, plastic or whatever, if you're more than 2 years in such a specialty, you'll be given a maximum of 5 marks for your experience. And then you need a supervisor report, 2 supervisor reports. And the maximum you get is 5 marks, but both comes from the 2 supervisors. That means whatever marks you get the 2 supervisors, it will be divided by 2. You also need to undergo an interview, of which carries a weightage of 20 marks. And the domains of the interview are in the list that I put forward here, including professionalism, clinical decision-making, teamwork, health advocacy, leadership, knowledge, technical skills, communication skills, and self-directedness. For KPJ, they usually take in 2 candidates, and the only criteria for KPJ is that your MCQ score must be within the top 120 candidates, and the oral interview panel, there will be a representative from KPJ and HUKM who will be conducting the interview. So now I will try to share with you some personal thoughts and maybe give you some advice how you can enhance your chances of entering the program. Well, this is what it is going to be like for most of you. There's going to be a lot of problems and a lot of doubters, a lot of pessimists who are going to put you down. But if you have got certain skill set and certain mindsets, you should be able to achieve your goals despite such limitations. So I would advise you to look at it strategically. Two of the sections of the interview or of the requirements are subjective. That means the supervisor report and the interview are subjective. One of the section may be out of your control, the work experience, because you may be posted anywhere according to the demand or requirement by KKM. However, the rest of these are within your control, meaning knowledge to do well in pre-test is within your control, that you can study and prepare well to do the test well. Initiative and sacrifice to attend courses and conference are also within your reach, and also hard work and know how to do research. But whatever it is, you can certainly find ways to succeed in all the sections if you persevere. And the tips for the interview, although the interview is subjective, but you can prepare for yourself for the interview. And because I've given you what is being asked, some things that you really need to know would include knowing meaning and definitions of terms and understanding the subject of interest. Because some of the candidates, when they have been asked what is leadership, they really don't understand how to define what is leadership or what is professionalism, what is it. So all this, I think it's about time for you all to do your homework to understand the topic. However, certain universities conduct some course to help you prepare for interview and they charge for it. So if you are willing to pay, they may help you to give you some tips on how to prepare for the interview. And just another point, the NOTS course conducted by the college, the non-operative technical surgical skill, covers 4 domains, which is decision-making, communication, and teamwork and leadership of the requirements of the interview. So it's just, these are some tips for you to take note. What about getting experience? Although I know this is out of your control, that means you may not be posted towards the posting of your choice. However, if you persevere, you should be able to get the posting, but you need to know how the system works. So postings are usually decided by the pengarah or the timbalan pengarah of the hospital. So you should know who to target, and maybe you may need to go and see the pengarah or the timbalan pengarah every month to remind them that you're interested in surgery, you're not interested in medicine. Whenever there is an opening, please remember to post you there. That is one way you can help yourself get into the posting of your requirement. Formerly, there was a plan to use housemanship training as a certification. That means if you do very well in your housemanship training, you will get a certificate. And if you were the top houseman, you can get to choose what posting you want. Currently, it is not implemented anymore, but you never know, this may come back in the future. So it is really worthwhile when you become a houseman to do your best as a houseman in the posting that you're posted to shine and let the head of department notice you, because sometimes if the head of department is impressed by you, he can certainly put in a word for you to be retained in that department in certain states. Some states, they have their own different criteria and you cannot stay back in the same hospital that you have been trained as a houseman. Good networking also is important. If you know of a colleague who has got doing a certain posting and he's not interested, you can always mutually exchange with him to get into this department that you're interested. However, the other thing that I should remind you is that when you choose a hospital and a department, sometimes if you choose the right hospital or departments where the head of department has got good will with a lot of other departments or other hospitals, this can really help you get your requirements. For example, you need to do a 6 months attachment in neurosurgery. This interpersonal relationship certainly helps to get the posting. The head of department can call the head of department of neurosurgery in the other hospital and request for you to do an attachment. And a lot of times, all this personal touch does help to get you to get the posting that you want. So I think choosing the right hospitals is important, although sometimes it's out of your control, but you need to do due diligence to try and find out which are the hospitals that can really assist you to get the training and posting and experience that you want to help you get into the master's program. Knowledge. Now, you need to identify your gaps and find ways to plug them. And nowadays, there are a lot of courses being run. So if you feel that you are weak and you find it difficult to read on your own because of many limitations, look out for all these courses and try to attend. The only problem, of course, is you have to pay for it. However, I think you should not be thinking of costs if you really are keen to do that program. So look out for all this, and it will be good if you have a mentor who can advise you and guide you in how to improve your knowledge too. Of course, look for courses that add value, enhance experiences, plug gaps, and fulfill criteria. And an example would be those courses that I've mentioned: ATLS, CRIS, CCRIS, NOTS. Not only that there are requirements, but they also add value to your functioning as a doctor. So even if you don't end up doing surgery, but you will end up being a much better doctor from these courses which are of international quality. Now, what is essential to pursue a career in surgery? So I'm sharing some of my personal thoughts and feelings. You need a good support system from family and friends. You need a mentor. The skill sets you need to keep abreast with information changes, not only about science, but especially about policy and politics, especially with regards to training. I told you, we are living in a now ever-changing world, and policies and politics change all the time. And tomorrow, whatever information I've given you may change. So if you don't keep abreast, you will be left behind. So in my humble opinion, I think mindset is the most important component, especially for you all in these trying times, not because of COVID, but because there are too many doctors around, and the competition and the uncertainty and the frequent changes. If you do not have the mindsets, you will find it really difficult. And what sort of mindsets you need? Flexibility and adaptability. It is not the strongest or the fittest that survive. That is why the cockroaches have outlived the dinosaurs. You need to be very adaptable. You need to be flexible when there are changes. And I'll share with you a few of my personal motivational posters that I use for myself. Life isn't about waiting for the winds to change. It's learning how to adjust your sail. So this is what I'm telling you about being flexible and adaptable. When things don't work for you, adjust your sail, change your approach, and hopefully you will find that you reach your goal. The other thing you must know that now we are living in the 21st century, and people in the 21st century are not those who read like what before, but you need to learn, unlearn, and relearn because of the change in knowledge, change in approaches. If you cannot be adaptable and flexible enough to learn and unlearn what you have learned and relearn again, you will be left behind. And lastly, I think this is one of the most important, especially for all y'all. You need to have grit. And what is grit? This is a book by Angela Duckworth. It's a psychological concept. And I feel that this is probably the most important for most of y'all, because most of y'all will find it difficult to get into the program, and you will be struggling and you will be applying again and again and again. Grit is actually the psychological research of success, and Angela Duckworth found that the most common and important factor required for success is to have grit. It is about what goes through your head when you fall. For example, if you apply to do masters and you don't make it, what goes through your head? How do you take it? And she finds that grit and not talent or luck makes all the difference. Everybody will fail. Most of us will fail. There are very few people who succeed on the first thing, but it's how we handle our failures and falls. And I can testify it because I have gone through it. I have gone through a lot of failures, and I am what I am today. I feel is because I have some of this grit. So grit is definitely more important than intelligence and talent, according to Duckworth. And it is actually a blend of persistence and passion. And the good thing about grit is that it can be learned. Grit has two components, passion and perseverance. Enthusiasm is very common, but endurance is rare. So if you have time and you have the energy, I recommend you to read the book. But if you don't have, I'll give you a short summary of how do you build grit in yourself. So this is all from the book, 4 proven ways to develop grit. One is practice. And practice is not just simply practicing how you like. Deliberate practice, learning from failure as you go, getting feedback from your experience and learning from others. Any failure is just another practice attempt. You must have purpose, something you must develop an interest in. You must have a goal. That's why I showed you the cartoon. You must have a goal to give you a purpose. You must have hope. Every time you fail, you embrace it as an opportunity to learn. Don't give up. And lastly, you must give yourself time to practice with purpose and hope to stay in the game. So in conclusion, the pathway to surgical training is not easy. I'm not going to sugarcoat it for you all, but with the correct skills and mindsets, I think you should eventually get there. So I'm open to questions, and I hope I've not gone over time, Ashkin? Have I gone over time?
Thank you, Dr. Ande, for that very informative session. So that's very informative session. So you can take one questions from the chat box, Doctor.
Okay, let me see the chat box now. Oh. I am lost now.
Can you see the questions, Doctor?
Yeah, now there. Yeah, I'm trying. Yeah, yep. Okay, I saw the few questions. Will MRSS give us advantage ahead in choosing department after HO? There was one question that asked that. Unfortunately, no, because your departments that you will be going to, it all depends on your pengarah and timbalan pengarah. If you're fortunate enough to get a pengarah who is very sympathetic and very flexible to allow you to enter the department of a choice, yes, he will give you the department of choice if you show him you have MRCS. However, as we know, with the government service, there are a lot of Napoleons around. So some pengarahs will not look at this as an advantage. So it all depends. So my final answer is that it depends on who is the hospital, which is the hospital, and who is the pengarah that you are in. Can I take another question? Or
sure, Doctor. One more question.
Is there another question? Yeah, it depends on your floating hospital. I think that's all. That's all. So, okay. Sorry if I've run out of time, Shkin. I was a little bit over.
Sure,
Because
it's
I'm
okay.
having problems with the controller.
Sure, Doctor. Thank you, Dr. Andre, for the excellent session. I'm sure the participants will be leaving the session today with a much clearer understanding on what is required in achieving their dream of being a specialist in the field of surgery. Once again, thank you very much. Dear delegates, I hope you have found that session informative. Please do not forget to sign into the next session that will be starting in 5 minutes' time. Dr. Andre, can I ask you to sign into the Zoom link for the second session immediately